Our group did the Supplemental Nutrition Assistance Program. To give a little bit of background, the Supplemental Nutrition Assistance Program, or SNAP, provides food assistance to low-income families. This policy helps families be able to provide healthy, nutritional meals even on a small budget. Eligibility requires the family to be at or below 130% of the federal poverty level. Families that are eligible for this assistance receive a monthly electronic benefit transfer card, or an EBT, to use at grocery stores to purchase nutritional or nutritionally adequate food items. Also, families that are eligible for an EBT card are also eligible for free school meals. Just a bit about the background. So it was passed on August 31st, 1964 by President Johnson, and it was previously called the Food Stamp Act of 1964. The policy's name was changed to the Supplemental Nutrition Assistance Program Act in 2008. The SNAP program is administered by various federal agencies, primarily the United States Department of Agriculture. The state's agencies are in charge of determining family eligibility by state. And then the target population for SNAP for the SNAP benefits are low-income households that include children, seniors, and persons with disabilities. In 2023, children made up 40% of SNAP recipients. Some key components of the policy are the benefit types. So some of them are emergency SNAP, disaster SNAP, state supplements, nutrition incentive programs, SNAP ED services, and then some eligible requirements to be able to get this funding is you have to meet a certain income, have certain assets, you have to be a citizen, you have to have residency, have to have a social security number, you have to work, and then some are students. And then for the funding, it's federal funded entitlement program administered by the U.S. Department of Agriculture, specifically the Food and Nutrition Service. And then the work requirements, most adults 16 to 59 register for work, or most adults are 16 to 59. They have to register for work, take suitable jobs, and they can't quit without a cause. Then ABA WDS of ages 18 to 52 have to work or train a minimum of 80 hours per month. And then some exemptions include pregnancy, people with disabilities, and then students who qualify. And then the overall main goal is to alleviate hunger, relieve food insecurity, and improve nutrition. And then some specific objectives are to reduce food insecurity, increase the ability for low-income families so they can buy a nutritious meal. And then alignment with the Code of Ethics is relevant values, service, it's meeting basic food needs, social justice, it's reducing hunger and inequities, dignity and worth, so it's supporting people without judgment, integrity, competence, knowing resources to better help people, and then ethical considerations, it's equitable access for all eligible individuals, and then it's protecting confidentiality of clients' information. It's also promoting honesty and accuracy in documentation, and then advocating for vulnerable groups that have barriers. Some implementation and access, so how to apply. You have to check for eligibility of yourself. If you meet all these requirements, then you can apply. To submit an application, you can do it via mail, fax, or online. And then you normally complete an interview over the phone. And then you have to provide documentation for certain things. So like you have to have an ID or like proof that you're working somewhere. And then you'll know within 30 days if you receive a determination if you're eligible. And then community partnerships. So some are community organizations. These help increase like funding and help those who are eligible for this program. Food banks and pantries and farmers markets have also allowed people to begin using their electric benefit transfer card at these places, so they're able to get groceries. Healthcare systems are allowing people to come in for like clinical visits, just for like checkups, schools and colleges, and then the local government continuously helps with the funding and then also just awareness and education on the programs. And then the benefits are distributed via the electronic benefit transfer card or the EBT card. It's similar to a debit card. Places that it can be used are the grocery store, convenience stores, farmers markets, and then some online retailers. And then you can basically get a lot of non-perishable foods, a lot of pantry safe food items, so like bread, canned goods, that sort of stuff. You cannot buy alcohol, tobacco, or like ready to go hot meals, so like fast food. And then challenges and access, so the administrative challenges, the digital divide, so some people don't have access to internet or a computer or a phone to submit an application to check if they're eligible or to complete an interview. And then there's some stigma around it, so some people are scared to apply because of the stigma, and they are a little fearful to apply. And then some people, there are language barriers because they don't have translators in every single area for this program. And then immigration concern because the lines blurred between the like mixed families. There's not really clear rules on that. And then work requirements and limited areas. So in like rural areas, there's not that many grocery stores in places that accept the electronic benefit transfer card. And then there's some supporting views. So one of them is like important in reducing poverty and food insecurity, improves health and outcomes in children, supports families and fights hunger, stimulates local economies. And then some critical views are it costs taxpayers a lot of money. It allows for unhealthy food choices, which won't benefit people in poverty and hunger in the long term, because it can lead to like certain diseases down the road. And then it may create dependency on this program, and then the program may need stricter oversight. And then policy impacts. So there's positive outcomes. It helps reduce food insecurity for millions of low-income families. It boosts local economies by increasing grocery store spending, supports children nutrition, health, and in turn academic performance. Remaining gaps benefits don't usually cover the cost of a healthy diet, and then some eligible people may be afraid to apply for the benefits. Unequal access nationally because the rural areas have less participating stores, and then low wage workers may have trouble maintaining benefits because of the work requirements. And then recent reforms, there's expansion of online grocery shopping options for the SNAP recipients, simplifying the application practice. The Thrifty Food Plan update increased the benefits by 25% in 2021, and then they have initiated pilot programs providing education on healthy and nutritious diets. And then to conclude, the SNAP program plays a big role in supporting low-income families by helping them access healthy and nutritious food even when they have a limited budget. By requiring certain households to meet eligibility guidelines set at or below 130% of federal poverty line, the program makes sure it reaches the most vulnerable people. Families who qualify receive a monthly electronic benefit transfer card that can be used to purchase a diverse amount of food items at particular retailers or participating retailers. And then on top of that, SNAP also provides further support by making children in eligible households automatically qualified for free school meals. Overall, SNAP remains an essential safety net that promotes food security for all and strengthens the well-being of millions of families. And then some discussion questions that we still had are: what areas of SNAP still need improvement? Is there any systemic barriers that may prevent eligible families from applying for for accessing SNAP benefits? How could the SNAP program be improved to better support rural communities or low-wage workers? Do you think the current benefits amount are enough to support a healthy diet? Why or why not? And then finally, in a more broad sense, is there a stigma around needing government assistance? And then here are all 6 of our references. And then here is how we split up our presentation. Thanks for watching.